Welcome, class. Well, we're back again talking about the nursing informatics and how you can use it to get best practices for your field. This section is on the analytics that we would use or we could obtain from documenting a patient plan of care using the CCC system. The analytics for the patient plan of care follows the information model, 6 steps, which provides a great deal of information for managing all levels of nursing services for an episode of illness. Such data can be used to generate evidence-based information, which would be based on the frequency of the interventions by action types, care measures by comparing the actual and the expected outcomes to the actual outcomes. And that would be a chart, and it works. We've done that several times. Also, you would get at workload and measures and resources such as the nursing action type by patient, by clinical condition, and or by nurse and or by unit. Cost measures would get at by calculating the action type using the clinical care classification. We have 2 formulas for it. One's called the relative value units, and we've tested it, and it does work. And so these 4 analytics are really the ones that would provide nursing with a great deal of information that they do not have at this point in time. Now let me show you the next exciting table, which is the patient plan of care for the action type encounters. Now this is different than just the action type for the patient plan of care. We have got some figures here that are just to illustrate the point. We put in the 4 action types regardless of the intervention, and we show you that you can do by frequency and by percent. But let me explain. When you perform a medication 4 times a day, it's not performed once, it's performed 4 times. And if you perform 4 times each day of a 5-day episode of illness, you have 20 encounters. 20 encounters can give you the cost and time of effort by the nurse providing that service. So that's what these 4 action types represent. The action types can also be used to represent what we call WAM, which is the workload, action, measures, method, solution. We've developed this process and have tested it and found that it works. What we've done is provide a similar, what we call acuity system or a cost, workload, and time system. And what it consists of is that we take all the encounters for each of the actions and use the relative value unit formula, which we have received from the office that does the Medicaid formulas, the formulas for the Medicaid payment. We've coupled that with the base value formula for the level of intensity based on for the patient's disease condition. By coupling the 2 variables, we get at the number of hours it takes to provide the services for these 4 actions for the patient for the episode of illness. This is exciting, and we've tested it, and we've proven that it does work. My best example today is the example by Jane Engelbright, who is the CNO of the Hospital Corps of America in Nashville, Tennessee, who has implemented the CC system in almost all of the HCA 160 hospitals across the country. She has implemented the CCC with the Meditech 5.6 system, the Meditech 6.0 system, and several hospitals that have the EPIC system. She's currently working on implementing the CCC in some newly acquired hospitals that have the Cerner system. What she did, and what is interesting about this Hospital Corps of America, is that all the data elements are processed in one place in Nashville, in the computer system of their headquarters. And so she was able to aggregate some 78 million data points that represent just the 4 action type qualifiers. And she used those for the management framework data that she uses to evaluate the cognitive work of her nursing staff. She has found and will be publishing how the CCC has provided a wealth of information regarding the HCA nursing staff workload based on their patients' coded nursing services using the CCC system. This is a pie chart with her 4 action types, and this is another way where she is getting other information about patient outcomes, nurse effectiveness, nurse efficiency, nurse engagement, and financial performance using the same 4 action types and the number of encounters that the nurses have worked with. This is exciting new data on nursing services that no one else has in the country. And I urge you, if you feel you are interested in what HCA has done, to contact Jane Engelbright, who is in the headquarters at the Nashville office. So, what have we got? As you can see, there are many values that one can obtain from the statistical analyses of the coded CCC terminologies. The coded data provides the knowledge that links the care processes of the diagnoses to the interventions and actions and to the outcomes. The statistics can be used to identify evidence-based measures for predicting best practices, and even selected macro value-based quality outcome measures. I feel very hopeful that this new legislation, and if we code nursing services, can be used to provide some reimbursement for nursing care or some reimbursement for the hospital that is offering services and is measuring the macro outcomes. Also, I believe that the CCC system can be used to justify and to validate the CMS 8 never events that has been in existence for several years. These events cost the hospital large amounts of money and could be saved by justifying the care provided by nursing services as evidence that they did not occur, or that the pressure ulcer was on the patient on admission, or that the patient, when and if was readmitted within 30 days, did so because of something that happened at home and had nothing to do with the hospital situation. We have so much data that we can offer that will influence the care processes of patients that need to be now included in the electronic health record. So the value of the CCC system using the patient plan of care, it can be used for clinical care, nursing practice. We can use it for reuse data, that is for other applications. We can be summarizing and aggregate it to highlight new information. We can use it for warehouses and big data systems that are being developed in many cities across the country or by several hospital chains. We would have data if we coded our nursing notes. We would have data if we documented and coded our patient plans of care and not just took at stagnant word process patient's plan of care plans out of textbooks. So to conclude, your documented services should always reflect your nursing background, and for this reason, I urge you to use the CCC system in your practice. It documents the essence of nursing care across the continuum, and it ensures the visibility and the viability of our profession. This slide provides you with the website where you can use and visit the CCC web user and visit the CCC website. There's so many exciting things on this website, and I want to point out just two of them, or three of them. First of all, it's being translated into many languages around the world. It's just got updated and translated into Chinese. It's been translated into almost every language in the world, and the languages and the translations are on the website for other countries to use. Everything is free that's on the website, including the terminology that you can download. And finally, with the one item I like, which is brand new, is the mobile-friendly lookup tool. It's an app that we just developed where you can, following the 6 steps of the nursing process, it's free. You can download it on your iPhone and or on your iPad. And I like the iPhone because the nurses could carry it around when they're documenting their practice easily, because if it's on the iPhone, they could put it in their pocket. So with this in mind, I think we've got a viable, feasible, free, coded terminology for the nursing profession and for all professions that need to document patient care services.